Hello Malaysia and welcome to another edition of Medical Today. I'm Gerard Ratnam and as always we have a fantastic show lined up for you. We're going to be talking about NCDs, more importantly with regards to NCDs we're talking about heart disease, a little something that apparently doesn't discriminate. We'll be having a cardiologist coming in very soon. Later on the show, we'll be talking about bariatric surgery. Now, do you know what bariatric surgery is? If you do, good on you. If you don't, stay with us. We'll come back and give you more information as to what that is. In the meantime, what we want to know is if we're learning more about medication. Well, on the show every week we try to give you information about the medication you're taking. Now we have a recording with Zulhazri Razali. He's a director and also a pharmacist with the commercial division of Pharmaniaga Berhad. We did speak to him at his office and we have an interview with regards to what he had to say about knowing your medicine. Here is that interview. Let's take a look at it.
Medicine is a preparation or something that is being used for the treatment or prevention of disease. Okay, there are so many different preparations in Malaysia or in the world where they have gone through a proper test or analysis by the authority, and they will categorize into different level of medicine. Can be a quite serious one and to the lowest category of medicine. There are several benefits and risks that you can talk about medicine. It depends on the nature of the medicine. For example, like something to do with to reduce blood pressure, all right, or something to do with to prevent your stomach acid, okay. So it depends on the disease or the treatment that you are getting from the doctor. They'll give you different kind of medicines for different benefits. When it comes to the risk, also every medicine, when you go to the specific product, of course the doctor will tell you the kind of risk that you are going to get if you take such medicine. It all depends on the patient and the doctor engagement. Okay, when the doctor prescribes to you certain medicine for certain condition, they will also tell you the risk. Okay, and this risk actually they will weigh against the benefits, and they will prescribe with the right dosage, with the right timing, so that the patient will get more benefits that outweigh the risk. Okay, for example, like if you take flu medicine, for example, you will get drowsiness, right? So if you really need to take that medicine, of course the doctor will say that you need to skip driving or doing any physical thing because it will affect your physical body. There are various levels of side effects of medicine. It can be as little as stomach upset or skin rashes, up to liver failure in fact. Alright, so these side effects actually, it depends on the product that you or the drug or the medicine that you are taking or you're given by the doctor. Okay, so most important is you understand what were given to you. Okay, you can ask the doctor what are those, and of course the doctor will willingly tell you the range of side effects that are related to that product, and they will also tell you things that you should not do while taking the drug. And also there are certain medicine that when you take, you've got to take, for example, after meal. So there's a reason about it. Maybe by taking after meal, they will reduce your stomach upset. So these are the things that if you understand well about what you are taking, then you are pretty okay in terms of managing the side effects. Again, as I said, it depends on the drug. There are some drugs, the side effect is very minimal, like skin rashes or the drowsiness is quite simple. But then again, you have a side effects where it can really make your system go bad. For example, like liver failure, or maybe side effects of kidney failure, because certain painkillers, for example, if you take too much, it can damage your kidney. So these are the things that you really have to understand. The medicine you've got to take as prescribed. The compliance is important, and the regular visit to the doctor and seek the advice from the pharmacy is important, especially when you take the more critical drug, more chronic disease drug, hypertension, what we call, or maybe the cancer product. These are the things that is very high risk and very quite a dangerous side effects. There is no real what we call guideline or things that we have to do on expired goods at home. Okay, most of the time I think people throw in the drainage or in the dustbin. So personally, I think just to minimize what we call any dangerous thing that thrown out elsewhere, I suggest we just crush the thing, pack it properly, and leave it to the what we call garbage collector, so that at least we know those people who collect garbage thing, they will incinerate. Right? But to prevent expired goods, of course, you've got to be disciplined as well. Right? You've got to consume as prescribed. Normally, the health professional will not give you too excessive quantity of medicine. Right? They'll give you at certain time, so they expect you to finish it off. So your compliance also important. And when it comes to certain medicine that you can buy over the counter, again, you've got to be very disciplined in buying certain things within your time frame. That means you can assure that you can finish it off before it expires. So that's the first thing that you've got to do to prevent any expired goods left in at home. My advice is you must seek your advice, or you're seeking your medicine information from the right channel. Okay, mainly on the pharmacy and the doctor. All right, these are the two areas where you definitely can get proper advice or proper knowledge about the medicine that you are taking or you are going to take. Okay, try to avoid social media or friends' advice or anything that non-professional in terms of medicine information. Understanding the medicine that you take is important. There are so many sources or channels that you can ask from, but the most important is you should ask from the professional, which is the doctors or the pharmacy. So when you go to the pharmacy, you can see a lot of products on the shelf. So you must understand which particular one is suitable for you. If you have a severe disease or severe things that you need to be treated, of course the doctor will give to you. At the same time, when you go to the pharmacy, you can always ask them things that you have been taken or you are given by the doctor. But please do not source your information from the non-professional way, which is the social media or the friends or any other channel, which is not really the right way of taking advice. So please drop by to the nearest pharmacy, like the Royal Pharma. The pharmacist will welcome you and will be able to advise you on anything to do with your medicine that you are taking for yourself. Thank you.
Gain insights from the people with the capacity to translate vision into reality. Interviews with corporate leaders. Monday, only on BNC.
Brings you the latest in current affairs, lifestyle and entertainment, as well as one-on-one discussions with fascinating personalities. Only on Bernama News Channel.
Kemajuan sains dan teknologi dalam perubatan sekalipun tidak mungkin mencipta darah. Ia hanya diperolehi melalui proses pendermaan secara sukarela. Darah yang didermakan akan diawasi agar berada dalam keadaan baik, selamat dan mencukupi. Seorang penderma boleh menyelamatkan 3 orang pesakit yang memerlukan darah atau komponen darah.
Termasuklah saya. Saya juga merupakan salah seorang yang pernah menerima darah yang telah anda dermakan. Terima kasih kerana menyelamatkan nyawa saya.
"9/11" menampilkan pelbagai segmen menarik khas buat anda. Saksikan 9/11 setiap Isnin hingga Jumaat 9 pagi. Hanya di Bernama News Channel.
Tak ada idea nak makan apa?
Panas, mari.
Tak tahu nak makan kat mana?
Wow, inilah pencuci mulut yang saya tunggu-tunggu ni.
Ada banyak kedai makan dengan 1001 menu yang saya boleh cadangkan.
Tengoklah. Wow. Dia punya sedap tu memang ada kelas lah.
Anda kenalah tonton Koleksi Tapak Apa setiap Selasa 4:30 petang.
Brings you the latest in current affairs, lifestyle and entertainment, as well as one-on-one discussions with fascinating personalities. Only on Bernama News Channel.
Gain insights from the people with the capacity to translate vision into reality. Interviews with corporate leaders. Monday, only on BNC. Thank you for staying with us right here on Medical Day. As promised, we're going to be talking about heart disease. And all of us know that heart disease strikes everywhere or everyone, regardless of gender, age, and also your weight. Or at least that's what science tells us today. Now, joining me in the studio is a consultant cardiologist, Dr. Chong Yun Sin, who's come all the way from Park City. He's from Ramsay, Sime, Darby Healthcare, and is with Park City, and he's joining us today to talk about heart disease. Now, there's a lot to be talked about and also to be discussed about with regards to heart disease. Now, how common is heart disease today as opposed to, say, 10 years ago?
Nowadays, heart disease is one of the most common medical conditions in Malaysia. All right, besides number one, which is the road traffic accident, followed by that is actually the heart problems. We have about 6 to 8% of the population actually having some form of heart disease, whether it's the rhythm problems, the valve problems, or coronary artery disease problem. So heart disease has become a major medical problem in today's country.
Right. It's very interesting because 13 years ago I had a heart attack, and the cardiologist that looked after me at that point was very young, and I said, look, you know, you look pretty young to be a cardiologist, using a catheter and doing invasive procedures. And he said, hey, you don't have to worry because we've got so much to practice on in Malaysia. And that, because what he was trying to tell me that back then heart disease was very prevalent, and you know, up until now, with all the programs we have to give people awareness about heart problems, it's still not getting the message out there. Do you think people are getting the message about it?
People get the message, but they just don't practice it. All right. 30 years ago, the common disease are infectious disease, TB, pneumonia, skin infection, and so on. But today, the demographic totally changed. We see young people, 30 years old, early 30s, who come with heart problems, heart attacks, rhythm problems, and we look at the populations that with the young population that coming now, they become more and more, and it's a major concern to the country.
Right.
Yeah, and usually, and this group of people are the product, in the productive golden age for the country, because they contribute to the economics. And once they strike with the heart problems, it can be fatal.
Now, once you have a heart problem, they say your life changes forever. And you see people who have heart problems. They come to you, and you meet them. They find out, you give them the bad news that they had a heart attack, heart muscles died, lifestyle has to change. Do people take these things seriously when you talk to them? And of course, alarm bells ring when you tell them, your heart, certain percentage of your heart is not working anymore. You'll have to live on medication for the rest of your life. But alarm bells ring at that point. But when they come back to you for subsequent checkups, have they changed their lifestyle?
Most of them, if let's say they listen, they actually change their lifestyle, all right, especially smoking, diet, exercise, and on regular medications and medical checkup with us, they actually do very, very well. For those small percentage of them who actually ignore what our advice is, ignore the medication, continue smoke, they do badly. They do badly. One of the best examples, because nowadays we have modern technology and modern science. Doctors, we have the technology and we have the knowledge to say that how can you take care of your heart. So a lot of time is that example I give you is Mahathir. Mahathir actually had a heart attack when he was 40, 50 years old. And she went through 2 bypass. And still strong today, 93 years old, become a prime minister.
Yeah, you know what they're telling me? I can lead a bad lifestyle and still go for bypass and live for...
Because she's very, she's very disciplined and she listened to all medical advices.
Right. Yeah. So it is about essentially taking that medical advice and using it, applying it to life. So always when we hear this cliche like lifestyle changes, you need to make lifestyle changes, most of us don't take it seriously. Like for instance, now people have given up smoking, but they now smoke their batteries. Everyone's vaping, and I have a lot of friends, even friends behind this camera, who are watching me now, saying that vaping is not bad at all. What are your thoughts on vaping? Of course, I know I'm springing this up on you last minute, but it's something that needs to be talked about.
These are bad habits, I would say. Number one, smoking, we always advise, it's possible, don't smoke. all right? And you can always count the number of cigarettes that you smoke, all right? You can say, tell me 1 packet, 20 stick per day and so on. So we know the number that you smoke. Whipping is you control yourself, all right? So, you know, you feel like putting how much nicotine inside, you put yourself, and nobody guide you on how much amount is it. So a lot of time you actually develop a nicotine toxicity, you know, when you take this inhale. Right. So a lot of time is like that's why there's one point in time that Ministry of Health actually tried to ban it, because you're actually causing toxicity to your body, and that actually can stimulate heart problems. All right, so I don't encourage that.
You don't encourage vaping. Yeah. Of course, there are cardiologists out there who say that vaping is not half as bad as smoking. There's some people who still believe that when you smoke lighter cigarettes, or you buy, there's a certain brand, there's a light brand, you buy the lighter brand and it's better. You know, still a lot of people who are out there doing things like this, but all in all, smoking is bad. What about smoking comes into play when it deals with when we talk about heart problems? You know, what in smoking is bad for the heart?
You know, smoking is already known. I mean, is the evidence that actually causing heart problem. Because you know, a lot of time is that in terms of the heart, if you smoke, you don't realize it. The smoke actually went inside the body system and go through the blood vessels and actually damage the blood vessels. And once the blood vessel is damaged, causing inflammations, cholesterol and inflammatory cell will stick to the area and causing accumulation of cholesterol plaque. Right. And that's why a lot of people who smoke tend to have multiple cholesterol lesions or cholesterol plaque in the blood vessel when we do the angiogram.
So what you're trying to say in turn is that it ups your risk of getting a heart attack if you're a smoker.
Yes.
Yeah, you want to keep the risk low all the time. It's a game of numbers, so to speak. Correct. So you keep the numbers down at all times. Now, they say that there's a hereditary link to heart disease. Yes. And heart disease does discriminate. Apparently, they told me I'm Indian and your risk is higher. Is that true?
There are genetic link to the heart disease. Yes, it's true. If let's say let's say the parents actually have a heart disease at age of 50, all right. The next generation, if they don't take care, the risk is actually 1 decade earlier. Right. 1 decade earlier. So people who actually have strong family history of heart disease, I always advise them to have early checkup, all right, and take care of themselves, all right, in terms of healthy lifestyle.
Right. Yeah. So it's very interesting to know that when you say Malay or Indian, they'll say your risk of having a heart attack, your risk is much higher. And that is true. Studies have shown that heart disease does discriminate. Why is it not prevalent amongst the Chinese?
If you ask me nowadays, I mean, we treated in Malaysia, Malay, Chinese, Indian. We tend to say Indian, but in today's world, all right, I would say all young people are high risk, you know, because of the lifestyle. All right, it doesn't matter which race are you in. Right. All right, if you don't take care of your diet with smoking, poor diets, a lot of high cholesterol diet, you will get it. You will get it.
Right. So once you get a heart attack, so there are ways of making sure that, you know, after you've had a heart attack, you can still lead a normal life.
Yes, Mahathir has proven that.
Mahathir has proven that. So with people who are coming to see you now, I know with intervention, what kind of early intervention can be done these days in order to ensure that one doesn't get a heart attack? Because I think the idea here is to ensure that the person doesn't get a myocardial infarction or a heart attack per se. Yeah.
Because nowadays heart disease is something that is a preventable disease. All right, we do not want a person to get a heart attack. The moment you get a heart attack, is equal to muscle damage, and your heart can stop. Right. So that is something that we do not want. So the technology has given us a lot of information that we can actually prevent you from getting a heart attack by screening and prevention.
Right. What about women? Some say that the estrogen protects women from having heart attacks. Is that true?
Partially true. Most of the time, you know, let's say, you know, if a lady come to me, you know, they are having in the menstrual period of time, meaning they're having before menopause. Right. The hormone actually protect the heart. It really protect the heart. It prevents the cholesterol from deposit in the blood vessels, so they are actually protected. But if let's say they have strong family history of heart disease, if they smoke and they don't take care of the diet, some of them do get very bad coronary artery disease.
Right. So, of course, there again, it depends on, it varies with different individuals.
Correct.
Right? I'll tell you what, we'll take a short break. When we come back, we're going to find out about symptoms. Everyone says your left arm starts to hurt when you have a heart attack. Some people believe that, you know, when you sweat, perspire, over perspire, you're going to have a heart attack. Some people say they have a striking pain coming down their chest. What does all this mean, and what are the early signs and symptoms of a heart attack? When we come back, we'll delve into that right here on Medical Today. Stay with us.
அரசியல், பொருளாதாரம், சமூகவியல், அறிவியல், விளையாட்டு, கலை, இலக்கியம், அனைத்துலக செய்தி என உடனுக்குடன் தகவல்களை கொண்டு வருகிறோம். புதிய பொலிவோடு, புதிய நம்பிக்கையோடு பர்னாமா தமிழ் செய்திகள். பர்னாமா அலைவரிசையில் மட்டுமே.
Ini Lokman, trendy orangnya. Setahun 5-6 kali tukar telefon. Tunggu, jangan main beli aja ikut nafsu. Pastikan telefon yang hendak dibeli ada label MCMC.
Hello Bapak, dah beli phone?
Itulah kan dah cakap. Beli peralatan komunikasi dan wireless harus pastikan ada label MCMC. Label MCMC menunjukkan peralatan tersebut selamat dan mematuhi standard yang ditetapkan oleh MCMC di setiap peralatan komunikasi dan wireless yang anda beli. Ceklah. Cek tahu. Jangan tak cek. Ada label, anda selamat.
Anda ingin menjadi kaya, tetapi awas, terdapat banyak skim-skim pelaburan tidak sah di pasaran. Jika ragu-ragu, anda boleh jumpa kami untuk memahami formula TIPU. Apa itu TIPU? T, tidak akan rugi. I, indah khabar dari rupa. P, peluang hanya sekali. U, untung besar. Ingat dan berwaspada dengan formula TIPU ini. Untuk sebarang pertanyaan mengenai pasaran modal, anda boleh hubungi kami. Gerakan Kuasa Pengguna musim kedua kembali. Bersiaran setiap Rabu pukul 9 malam hanya di Bernama News Channel.
"9/11" menampilkan pelbagai segmen menarik khas buat anda. Saksikan 9/11 setiap Isnin hingga Jumaat 9 pagi. Hanya di Bernama News Channel.
Hello and welcome back to Medical Today. I'm Gerard Ratnam, and together with me is Dr. Chong Yun Sin, a consultant cardiologist from Ramsay, Sime, Darby Healthcare. And we're talking about my favorite disease, heart disease, and he has specialized in it for a long time. He's also worked on a team helping Tun Mahathir with his second bypass, yeah? And it's good to know that you've kept the man alive and he's here for a reason. Yeah. We're all happy to have him. Well, that aside, we always think we have symptoms of heart problems. A lot of people get a pain like lightning down the chest. You know how people describe pain in different ways, and when they get, say, a pain in the chest, they believe it's probably a heart problem. So when do you tell when can you know, or rather, when would it show that you're having a heart problem?
Yeah, I mean, a lot of time is that the public actually aware that, when you have a chest pain, when you're sweating, when you have pain radiating to the arm, that's heart attack, all right? But a lot of time is that the people who come to us, which is cardiologists who come to us, the pain can be very, very, all right? So they can have chest pain, they can have epigastric pain, which a lot of time they thought is gastric, it's actually a heart attack.
Right. So epigastric pain is here near the sternum.
Correct. Yeah? Correct. And then some of the patient actually develop difficult to breathe. So that is actually signs of a heart attack as well. And usually, if let's say a person suddenly sweat a lot, all right, and the shirt all wet, that's something that I'm very concerned about, whether it's a heart attack or not. If a person suddenly faint, collapse, that is also another sign of heart attack.
Some people always feel, they have costochondritis and they believe, I think it's every time they breathe, they feel a pain. Some people panic with that and they believe it's heart problems. So, how can we give out advice now to kind of ascertain whether it's muscular or it's a heart attack?
It can be difficult. It can be difficult. Usually, let's say you have some sort of discomfort around the chest area, you're not sure. Please come and see a doctor and do some simple basic tests to rule out whether there's a heart attack or not.
It's very interesting because when I had a heart attack, of course, this is information I'm divulging over a national TV. When I had it, it felt like I wanted to belch, but I couldn't. And it kept getting worse and worse. And then you start breaking into sweat. But I was aware at all times as to what was happening around me. Just that it felt like you wanted to belch, but you couldn't, and your chest starts to tighten.
Sometimes the symptoms can be vary from individual to individual, male to female. So a lot of time, let's say it's a female, the symptoms can be more severe, all right, can be more of difficult to breathe. And in elderly patients, sometimes the symptoms can be just unwell. They're just unwell. So if let's say any symptom that persists and doesn't go off, please see any of the doctors, to rule out any acute conditions.
Right. And when you read articles or blogs from medical health practitioners in the UK, and this was something I read 10, 15 years ago, and they say, you always have to take, whether you have a heart problem or not, you need to take at least a baby aspirin to make sure your blood's thin. Why haven't we practiced stuff like that here in Malaysia?
By right, let's say you have any heart attack, the first thing to do is actually take any of the blood thinner, because that actually really helps, because the clot is not formed well yet. So the moment you take a blood thinner, it dissolves it and that saves life. But the thing is that the aspirin is not widely available, all right, in the stores and things like that. In places like America, they have baby aspirin widely available in the commercial, those sundry shops, which is 81 milligram. And that can be, you just buy like in 7-Eleven, in things like that,
over the counter.
Correct. So, and do not need prescription.
But here's the other thing, with medication for the heart, there's also side effects that come along with it. A lot of people who are on cholesterol medication or cholesterol drugs like statins have bodily aches, they find it hard to deal with the bodily aches. So what do you do when you're presented with problems like these?
Let's say any of the patients who have heart problems, all right, they usually have hypertension, cholesterol, sugar, and so on. And usually, I would give the medication based on each of these disease. And usually, the patient will come back to me to follow up and see whether the medication work or not, whether any side effect or not. And if there's any side effect arise, we know what to deal with it. A lot of time is that nowadays the medication, the side effect is actually very, very minimal compared to our grandparent time. They say all medication cause kidney problem. Nowadays it's actually very minimal. And like what you mentioned just now, the statin, all right, the muscle pain is actually not common. All right, it's about 1 in 100,000 patients or populations. So it's actually quite rare. But the moment if you have that, then be aware of that. We can stop it and you can deal with some other issue.
Okay, and what about blood thinners? So, the safest or the first go-to standard would be aspirin.
Correct.
And if you're having gastritis or high acidity, it kind of gives you gastro problems, right? Then you move on to stuff like clopidogrel, and it goes. What's new in the range of blood thinners these days?
The blood thinners are, aspirin is the oldest one. It has been around for past 400 years and it's proven to be effective and it's cheap. But the problem is that it causes gastritis. There are about 10% of the population can't really take aspirin. So we move on to Plavix, which is around for the past 15 years. It's doing quite well. Right. And of course, there are
Plavix is the brand name, clopidogrel is the drug we're talking about.
There are the newer medication like Brilinta, which is more expensive. We put it as a second line.
When you say if it's more expensive, is it safer?
Yes, it's safer. It's safer. But the thing is that it's newer, so it's more expensive.
So every time something is newer, it's more expensive. So if I were to put clopidogrel with Brilinta and say which one's safer, would you say Brilinta is safer?
I would say same.
Same, it's the same.
Yep.
Yeah. So with understanding heart disease and also keeping yourself safe from heart disease, what would be your advice to all of us?
Stay healthy and prevention. These are the two things that is key. Stay healthy means that number one, make sure you do exercise regularly. All right, mild to moderate exercise is good for the heart. Strenuous exercise is actually bad for the bones and muscles. All right, so exercise means that 3 times a week, half an hour, any form of exercise that you want to do.
So all of us have got counters now to tell us how, give us our beats per minute and whatever. Everyone's very health conscious. So essentially 3 times per week, how high do you want to bring your heart rate up to?
The recommended is actually 220 minus your age. Okay. All right. So 220 minus your age. If you can achieve 85% of the target heart rate of that, is good enough. Is good enough.
So 220 minus your age, and if you can achieve 85% of that, that's what you're looking for. Correct. At least 3 times a week.
Yes.
And that's the bare minimum.
Correct.
Right. With treatment options, what are the bigger treatment options out there? There's stenting, ballooning.
The treatment nowadays we have divided into 3. One is medication, of course. All right. Medication basically to thin the blood, to make the blood vessel more relaxed, lower the cholesterol level, lower the sugar levels, and lower the hypertension. The treatment, further treatment, let's say if it's a very tight cholesterol lesion, then we can always go for angioplasty, which is a balloon, put in a small balloon into the coronary artery or the heart. And nowadays it's actually very simplified, all right? It can be done in the daycare procedure. We give some painkiller on the wrist, all right? And then put a small needle, 1.8 mm plastic tube, 1.8 mm, and go straight to the heart, and we can find the blood vessels. And in order to proceed with the balloon, it takes about another 10 minutes, and that's it, all right? And it's done, and you go home 6 hours later. But if, let's say, certain cases, which is unfortunately multiple block, very complex, very difficult, we may suggest for a bypass, which is open heart, that carry a bigger risk.
But with bypass surgeries these days, it's not what it was 25, 30 years ago. After a week, you're out of the hospital already. So things are getting better with regards to health care and heart care, and techniques are getting better. Medications getting more focused now, and we've got better things coming your way. The only thing is, whatever you do with regards to heart problems, make sure you see a specialist like Dr. Chong here and find out if you're not sure. Never self-medicate, never Dr. Google when it relates to the heart or if it's a matter of the heart. On that note, Dr. Chong, it was a pleasure and an honor having you here. Thank you very much for joining us. We hope to have you back again so we can do more of a discussion with regards to heart care and health care right here on Medical Today. We'll take a short break and come back right after this break. Stay with us. This is Medical Today on the Bernama News Channel. Gain insights from the people with the capacity to translate vision into reality. Interviews with corporate leaders. Monday, only on BNC.
அரசியல், பொருளாதாரம், சமூகவியல், அறிவியல், விளையாட்டு, கலை, இலக்கியம், அனைத்துலக செய்தி என உடனுக்குடன் தகவல்களை கொண்டு வருகிறோம். புதிய பொலிவோடு, புதிய நம்பிக்கையோடு பர்னாமா தமிழ் செய்திகள். பர்னாமா அலைவரிசையில் மட்டுமே.
Gain insights from the people with the capacity to translate vision into reality. Interviews with corporate leaders. Monday, only on BNC. Listen to views of industry captains. Analyze and examine trends and projections. Gain market insights from subject matter experts. Biz Talk every Friday only on BNC.
The Nation, a talk show from the Current Affairs desk with in-depth conversations on health, women, property, culture and performing arts. Only on Bernama News Channel.
Do you know what really happens to your mobile e-waste? Throwing them into the dustbin will only result in choking the landfills. Did you know that over 42 million mobile e-waste are not properly disposed of? And this amount will continue to grow. This will potentially cause toxic chemicals to seep into the ground. The environment will slowly be polluted, thus creating a multitude of health problems to us humans. Did you know that 90% of the materials used to make mobile phones and the accessories can be recovered and recycled? These can be reused to make anything and everything, including electrical goods. Well, the good news is MCMC has initiated a mobile e-waste campaign. MCMC, along with telecommunications companies, have set up collection areas for the public to safely dispose their mobile e-waste at participating outlets. With 72 outlets nationwide including TM, U-Mobile, Maxis, DG, Celcom and Altel, you can now dispose your e-waste easily and at your convenience. Join us to get 1 million recycled mobile e-waste for this campaign. Make a difference for a better world, better environment and better future. For more information, log on to mobileewaste.mcmc.gov.my. This initiative is brought to you by the Malaysian communications industry together with MCMC.
Hello and welcome back to the final segment of Medical Today. As promised, we're going to explain to you and find out what bariatric surgery is all about. Joining me in the studio is Dr. Pok Eng Hong. He's a consultant general surgeon from Ramsay, Sime, Darby Healthcare, and is here to talk about being overweight, how that links into NCDs, and also understand a little bit about what bariatric surgery is. Dr. Pok, thank you very much for joining us. It's good to have you here now.
With you?
Well, when we talk about weight loss surgery, I guess it is bariatric surgery. So how do you explain this to us? Bariatric surgery, what does that actually mean?
Well, we know that obesity is a problem in Malaysia, and most of people with obesity have problem of disease.
Yeah.
Okay, it comes with a lot of medical problems, diabetes, hypertension, stroke, heart attack. So, and there's a problem for them to lose weight.
Right.
They have tried many methods, but the effect not long term. Most of the people have problem with weight regains after a few years. So there's come of the definitive method to lose weight. and it's called surgery. Although surgery itself is very
but for the longest time, you know, we've been saying that anyone who goes for these kind of surgery do it for cosmetic reasons and not because of health reasons.
Well, I think the concern.
Yeah.
Well, I think surgery is a solution for obesity at the moment. We know obesity is a disease which you cannot control. So by doing surgery, you force your body to lose weight, and it's very effective in short term and long term. But the benefit of this surgery not only losing weight, you also reverse a lot of medical conditions associated with obesity.
Okay, what's the difference between surgery and liposuction? Is there a difference?
Different.
Yeah.
Liposuction basically is a body controlling surgery. It just removes the peripheral fat.
Right.
Bariatric surgery is different. It's a surgery to change, to arrange the gut, and is force your body to lose weight. In other words, it reset the set point of obesity.
Right.
By doing obesity, you change your eating habit. You force the body to lose weight.
Okay, so how does this happen internally? So what do you do internally that changes my eating habits?
Well, bariatric surgery is a few surgical procedures available. For example, sleeve gastrectomy, which remove 90% of your stomach to make your stomach a very small tube.
Right.
And by doing it, you eat very small amount of food. For example, one stick banana, you feel full, you cannot eat anymore. So you limited amount the food you eat and force you to lose weight.
Right.
Okay? It's reduce the calorie intake a day. So
wouldn't that be the ideal life, eating one banana a day?
Yes, definitely. For those people, big eater is a suffering. That's why breast surgery is a very serious consideration to lose weight, and it's a final answer for those people with serious obesity.
Right.
And the other operation, which is more aggressive, we call bypass surgery, where you cut the body in two halves and join small bowel to the upper part of the stomach. You call bypass surgery. This is more aggressive surgery, and is work for those people with severe obesity and those people with especially have diabetes, and it work well.
How many people, like, when you talk about doing surgeries like this, people have to think about it, and they have to get second opinions, and then probably think about getting the surgery done. Let's talk about young people. How many young people have you performed this surgery on?
Well, I would say most people is middle income group, where they have tried many methods to lose weight.
Right.
I got one patient that spent more than 80,000 to a slimming program, or the dietary exercise, and failed to lose weight. Eventually, they come to see me. So I would say young people, they might not consider this unless it's very, very obese and causing medical problem. So most people, middle income group, they have resource economically to perform asking for this kind of surgery. And most of medical problems occur, obesity, when you're after certain age group.
Okay.
Yeah.
So I don't see how this works, saying I have a problem with obesity. I need to see a physician first. Then the physician tells me what my problem is, and he thinks I need surgery. Does he then refer me to a surgeon like you?
Well, I would say bariatric surgery is a very new concept in Malaysia. Most of people don't aware there is this kind of surgery to help people to lose weight. And of course, in order to see a bariatric surgeon, you must know there's a center which can perform this highly skilled surgery with a good outcome. I would say a few centers in Malaysia are able to do it with a good outcome.
Right.
So in order to find this kind of surgeon, of course, they must aware this kind of surgeon.
Right. So it is quite a niche area of expertise, and only a very few surgeons do it. Yeah. So of course, word goes around that you do it, and if anyone has a problem, they come see you straight away.
I would say that bariatric surgery is as safe as removal of gallbladder surgery, provided done by highly trained profession with all the new technology. And it was done by keyhole surgery, not open surgery, where the surgeon put a few holes in the abdomen and put instrument in with the TV. It helped. And why we do it? Because obese people itself is a dangerous patient. If something go wrong, patient can have serious consequences.
Right. You know, when I listen to you talk about shortening the stomach, doing bypasses. So with changes like that, there needs to be lifestyle changes, more so dietary changes. I mean, when you talk about dietary changes, they're not small dietary changes. You can't eat like you used to. So after surgery, post-surgery, do you give them that training or walk them through the regime as to what they can eat?
First, when the patient comes to see me, I have a frank discussion with them. What is surgery about? How we perform the surgery? What kind of dietary habit they need to change? Because surgery is just part of the program. In order to have good outcome, you must follow the diet, taking the vitamin, and do regular exercise to achieve good outcome. And with the help of dietitian, there's a regime of diet, step 1 to step 4. We slowly ask you to follow the diet until you're able to eat certain amount of food.
The various stages, and of course you work hand in hand with the dietitian post-surgery in order to make sure the person comes back to optimum health and leads a normal life again. Now, for people opting for surgeries like this, saying if I have to take leave off work to get a surgery like this done, how long will I be off work?
I would say most people, I will ask why to rest for 2 weeks after surgery. Why? First reason is you feel tired after surgery. First, you cannot eat well. You feel little amount a day, you feel very tired. So the best, you take 2 weeks off, slowly advance in a diet. Only after that you can maintain, get back your normal life.
Right. What are some of the misconceptions about bariatric surgery?
Bariatric surgery is very risky surgery. It's not, with the modern technology, it's not risky, and provided done by
like you said, you have to be a well-trained surgeon. You just can't be a surgeon. But and like I said before, this is a niche area of expertise. So it is safe in the right hands. Right. So make sure you see the right person. Okay. What are the other misconceptions?
Misconception
or myths surrounding bariatric surgery?
Well, I would say that bariatric surgery not only to people to help to lose weight. You also help people to treat obese type 2 diabetes patients. And most of the patients come to see me not only obese, but they have diabetes. So now we change the focus to treat by using the bariatric surgery to treat diabetes in very good outcome. Most of my patients is initially on multiple
So when you say diabetes, you're talking about type 2 diabetes here. So how does it help with type 2 diabetes? Because it's something you develop, and as your pancreas doesn't produce any insulin anymore or loses its ability to produce that insulin, type 2 diabetes sets in. Now, how do you help that?
Well, over the years, we found patients with when after bariatric surgery, they're obese, we don't know what's the reason that diabetes will control well. So nowadays we know that diabetes may be due to the dysfunction of our gut, the GI tract. So we now find a solution. If you're able to manipulate our gut, your surgical diabetes may be disappear. So that's why gastric bypass through gastrectomy is very effective at the moment to treat diabetes. How we work? There's a few possible mechanisms involved. First, you limit the amount of food you eat, reduce calorie intake. Second, he arranged the timing of the nutrient sensing in your body, which send a signal to your brain and etc. Second, you change your bile acid component in your body, which make your body more sensitive to glucose and absorption. Second, also it change the bacteria in your gut, which but affect your body in kind of diabetes. So we do not sure why, but we know that it works at the moment. And that's why worldwide at the moment they have endorsed bariatric surgery, one of the options to treat those patients with diabetes.
So in a week or in a month, how many people would you essentially see as a surgeon specializing in bariatric surgery?
Well, depends on the awareness of the population. I would say a month, I would say about 5 to 10 come people asking for opinion for bariatric surgery to treat obesity or diabetes. I will have frank discussion with them, the option available, and also the financial resource. But we know that although obesity is a disease, But our problem is a very expensive surgery at the moment.
Right. Now, I think the million-dollar question here is, how do you ascertain obesity? What is obesity? Now, I may be watching this program now, maybe a bit conscious about my weight and say, oh God, I'm fat.
You're not fat.
Yeah, so saying someone's watching it, thinking that he or she is big and they've passed the threshold of obesity, how do you ascertain that?
Well, obesity, basically accumulation of fat in your body. Okay, by conventional way, we can define obesity by a certain parameter. First, we can use it as a BMI, body mass index, where we divide the weight in kilogram into the meter square. You define a certain limit. If your BMI more than 30, you consider obese. BMI more than 40 is morbid obese with certain medical condition. So this kind of condition, BMI more than 30 to 35, I would say you're entitled to ask for opinion for obesity surgery.
More than 30, you fall in the obese category.
Obese. 35 is a
when are you a ticking time bomb? 40? 35?
I would say when more than 35, you have medical problem. It's more than 40, definitely you got a lot of problem. Joint pain, back pain, possible diabetes, hypertension, or heart problem. Now the new thinking, we call visceral fat in your abdomen. It's a waist circumference in more than 90 centimeters in Asian population. You consider have a higher risk of metabolic syndrome.
Right.
Because you call center obesity. This is another concept for obesity.
So saying if someone doesn't have obesity, he's big, not BMI still in the okay range, but he's having problems with his liver, fatty liver, so on and so forth. Can you do something?
Well, if you find it's very strange, obesity. It's not about the amount of fat, about the distribution of fat in your body.
Right.
Especially visceral fat. It's just the center
Which
abdomen.
means I essentially don't have to look big size too.
No,
I can be fat.
It's a fat percentage of your body give you a problem. If you have higher fat percentage with the metabolic, causing a metabolic syndrome, you can consider for metabolic surgery to treat your medical condition.
Right. Dr. Pok, that was a wealth of information from you. Thank you very much for coming in and for sharing with us all this information about bariatric surgery. Now, for those of you who have questions with regards to all the interviews we had, we spoke to a cardiologist, we're speaking to a surgeon who specializes in bariatric surgery, that is for those of us who suffer from obesity. This is the man to see. Now, if you do have a question for us, send that question to ask@medicaltoday.my. That's ask@medicaltoday.my. And while trying to give you an answer, we'll also furnish you with some vitamins courtesy of Pharmaniaga right here on Medical Today. Once again, send your question to ask@medicaltoday.my and we'll give you a bottle of vitamins for free right here on Medical Today. Dr. Pok, thank you very much for joining us. And thank you for being a part of the show. We'll be back next week with more for you on Medical Today right here on the Bernama News Channel. You have a great day ahead. Have a fantastic weekend and have an amazing week.